Welcome to our channel. Today we're taking a close look at the incredible journey of HIV management. From the darkest days of the epidemic to the groundbreaking discoveries that have reshaped the landscape of this disease, we've come a long way. Remember when a diagnosis of HIV was seen as a death sentence? It's amazing to think how far we've come. Today, thanks to the tireless work of scientists, doctors, activists, and people living with HIV, it's a manageable chronic condition for many. We're going to break down these life-changing advancements, explore the science behind them, and most importantly, share stories of hope and resilience. This is about empowering ourselves with knowledge and understanding. Let's talk about a true revolution in medicine, antiretroviral therapy, or ART. This isn't just a treatment, it's a lifeline. ART steps in to give your immune system a fighting chance. HIV attacks CD4 cells, crucial for your immune system. ART is a combination of medications that block different stages of the virus's life cycle. One medication might prevent the virus from entering your cells, another stops the virus from replicating. ART dramatically reduces the amount of HIV in your body, known as your viral load. When taken correctly, ART can suppress the virus to undetectable levels. People on ART can live long, healthy lives and have no risk of transmitting the virus to their partners. Undetectable equals untransmittable, or U=U. RT has increased life expectancies for people living with HIV, approaching those of HIV-negative individuals. It's not just about quantity of life, it's about quality of life. ART helps people with HIV live healthier, more fulfilling lives. We've talked about transforming HIV from a fatal disease to a manageable one. But what if we could prevent new infections in the first place? That's where pre-exposure prophylaxis, or PrEP, comes in. This is a game-changer in HIV prevention. PrEP is a daily medication that people who are at high risk of contracting HIV can take to drastically reduce their chances of becoming infected. Think of it as a powerful shield that strengthens your body's defenses against the virus. Here's the science behind it. PrEP contains two medications that are also used in ART. These medications work by stopping HIV from replicating and establishing an infection in your body. It's like having a protective barrier that prevents the virus from getting a foothold. Studies have shown that PrEP is highly effective in preventing HIV when taken as prescribed. In fact, it can reduce the risk of HIV infection through sex by about 99%. That's incredible. PrEP is a crucial tool for people who are at higher risk of HIV infection, such as those who have a partner living with HIV, those who have multiple sexual partners, or those who inject drugs. It empowers individuals to take control of their sexual health and significantly reduce their risk. Of course, it's important to remember that PrEP is not a magic bullet. It's most effective when used consistently and correctly. Regular HIV testing and other prevention methods like using condoms are still essential. We all know that early detection is key when it comes to managing any health condition, and HIV is no exception. In fact, early diagnosis and treatment are absolutely crucial for achieving the best possible outcomes for people living with HIV. The good news is that HIV testing has come a long way. It's easier and more accessible than ever before. Gone are the days of long waiting periods for results. Rapid HIV tests can provide results in as little as 20 minutes, using just a small sample of blood or oral fluid. These advancements in testing technology have been instrumental in promoting early diagnosis. When HIV is detected early, treatment can be initiated sooner, which is essential for preventing damage to the immune system. Early diagnosis also allows individuals to make informed decisions about their health and take steps to protect their partners from infection. Remember, knowledge is power. The sooner you know your HIV status, the sooner you can take action to stay healthy. Everyone should get tested for HIV at least once in their lifetime, and more frequently if they engage in behaviors that put them at higher risk. There's no shame in getting tested. It's a responsible and empowering step towards protecting your health and the health of others. Chapter 4. Staying ahead of the curve, viral load monitoring. When it comes to managing HIV, knowledge is power. That's why viral load monitoring is crucial. It tracks the amount of HIV in your blood to ensure your treatment is effective. Think of it like a GPS for your HIV treatment. It shows if you're on the right track or need adjustments. A viral load test measures HIV RNA in your blood. The goal is to suppress the viral load to an undetectable level. This means the virus is so low it can't be detected by standard tests. Regular monitoring ensures your treatment is working. If undetectable, your medication is effective. If it increases, it could mean resistance or non-adherence. This early warning system is invaluable. It allows adjustments to keep you ahead of the virus and maintain health. Managing HIV is about more than just medication and medical care. It's about addressing the social and emotional aspects of living with the virus. That's where community outreach and education play a vital role. Stigma and discrimination have long been major obstacles for people living with HIV. These harmful attitudes can prevent individuals from seeking testing, disclosing their status, and accessing the care they need. Community outreach programs work tirelessly to combat stigma and raise awareness about HIV. They provide a safe and supportive environment for people living with HIV to connect, share their experiences, and access vital resources. These programs often offer counseling, support groups, and educational workshops to empower individuals and help them navigate the challenges of living with HIV. Education is also paramount in the fight against HIV. By providing accurate and up-to-date information about the virus, transmission, prevention, and treatment, we can help people make informed decisions about their health. Community outreach programs often conduct educational campaigns targeted at specific populations that are disproportionately affected by HIV. They also work to train healthcare providers and other professionals on how to provide culturally competent and sensitive care to people living with HIV. The world of medicine is always evolving, constantly searching for new and innovative ways to improve people's lives. In the field of HIV management, one of the most promising areas of research is the development of long-acting treatments. Imagine a future where instead of taking daily pills, you could receive an injection or implant that provides long-lasting HIV treatment. This is the potential that long-acting therapies hold. They could revolutionize the way we manage HIV, making it even easier and more convenient for people to adhere to their treatment plans. Researchers are currently exploring a variety of long-acting formulations, including injectable medications and implantable devices that slowly release medication over time. These innovations could offer several advantages over daily oral medications. For one, they could improve adherence to treatment. Forgetting to take a daily pill is a common problem, but with long-acting treatments, you wouldn't have to remember to take medication every day. This could lead to better viral suppression and improved health outcomes. Long-acting treatments could also reduce the stigma associated with taking daily medication. Instead of carrying around pills or having to explain their medication regimen to others, people living with HIV could have greater discretion and privacy. The fight against HIV is a global one, and achieving an AIDS-free generation requires a collective effort from governments, organizations, and individuals worldwide. The good news is that significant progress has been made in recent years, thanks in part to the tireless work of organizations like UNAIDS. UNAIDS, the Joint United Nations Program on HIV/AIDS, is leading the global effort to end the AIDS epidemic by 2030. Their work focuses on 4 key areas: prevention, treatment, human rights, and sustainable financing. Through their advocacy and programs, UNAIDS has helped to dramatically increase access to HIV treatment and prevention services worldwide, particularly in low- and middle-income countries. They have also played a key role in reducing the stigma associated with HIV and promoting human rights for people living with and affected by the virus. One of the most important aspects of UNAIDS's work is their focus on reaching key populations that are disproportionately affected by HIV, such as men who have sex with men, people who inject drugs, sex workers, and transgender people. By addressing the unique needs and challenges faced by these groups, UNAIDS is working to ensure that everyone has access to the information, services, and support they need to stay healthy. The progress we've made in the fight against HIV is a testament to the power of collaboration, innovation, and compassion. By working together, we can continue to move towards a world without AIDS, where everyone can live long, healthy, and fulfilling lives. We've covered a lot of ground today, from the groundbreaking science behind ART and PrEP, to the importance of community outreach and global initiatives. While challenges remain, these advancements have greatly improved the management of HIV disease worldwide. Remember, knowledge is power. Stay informed about HIV, get tested regularly, and talk to your doctor about prevention and treatment options. By working together, we can continue to break down stigma, increase access to care, and move closer to a future free from AIDS. Stay informed, stay safe, and thank you for watching. Don't forget to like, share, and subscribe for more updates on health and wellness.